months, I have heard firsthand from people who face mid to long-term effects of COVID-19 infection. What's really concerning is the vast spectrum of symptoms that fluctuate over time, often overlap and can affect any system in the body, from fatigue, a cough and shortness of breath, to inflammation and injury of major organs, including the lungs and heart, and even neurological and psychological effects. Although we are still learning about the virus, what's clear is that this is not just a virus that kills people. To a significant number of people, this virus poses a range of serious long-term effects. While people do recover, it can be slow, sometimes weeks or months, and it's not always a linear route to recovery.
Team lead clinical care for COVID-19.
The Emergency Committee on COVID-19 has just concluded a two-day meeting where they discussed the way forward. With global cases continuing to rise and some countries going in the wrong direction, the group has made a series of recommendations for WHO and member states to act on. The take-home message is that it's important for governments and citizens to keep focused on breaking the chains of transmission. Governments should focus on tackling the virus and avoid politicization. No matter where they are in terms of the outbreak, they should keep investing in the health system and workforce and improving testing, tracing, and treatment of all cases.
Medicines and health products.
And there is light at the end of the tunnel. As well as rapid tests and dexamethasone, several vaccines are now in final phase 3 trials. If proved safe and effective, they will be rolled out through the ACT Accelerator's vaccine arm, the COVAX facility, which is now supported by 186 countries. I thank Lebanon and Botswana for joining recently.
But we now know that early recognition of patients is necessary in order to apply the right isolation, which we know to stop transmission, but also to apply rapid diagnostic testing and rapid care for patients. We know the symptoms now, just not the typical symptoms, but we also know atypical symptoms of patients, so we can recognize them even when they come in with atypical symptoms. For severity of disease, we knew about pneumonia, we knew about ARDS and patients requiring invasive ventilation, but now we also know about the other complications such as stroke, cardiac disease, and other causes of thrombosis, so we can apply treatments for those conditions. And now, as Maria had already mentioned, we do have one life-saving treatment, and this is for patients with severe or critical COVID, so the use of corticosteroids, which reduces mortality.
I was wondering, does the WHO have...
What we learned from the first peak was when the hospitals got full, the care got complicated. It is hard to care for patients, that many sick patients in an ICU. And so I think we have to remember that lesson and to stop transmission, stop patients from getting sick or getting very sick so that the health system can stay functioning and care for all patients. So thank you.
Is that the way?
Some countries were caught behind the curve. Some countries got disease early without the knowledge we have now. So we should not judge individual countries. In that sense, the real judgments don't come in the first wave of any epidemic because nobody has all the information. The question is right now, we have seen this wave pass over the earth. We have seen approaching 50 million people infected, confirmed. We're seeing over 1 million deaths. The question is, are we willing to apply the learning? Many people have paid a heavy price. Have we learned? Yes, we have. That's not the problem or the challenge. The question is, can we apply the learning? And can we do that now as numbers rise again?